Hello and welcome to Medicine Across Borders.
Hello. I'm Eddie, and with me today we have Dr. Sebastian Bułynko, a good friend of mine, and we're going to be talking about staż in Poland. It's a topic which I think a lot of English division don't really know about, but staż effectively is the Polish internship. So after you graduate in Poland, whatever division, if you want to work in the EU or in Poland later, then you need to do an internship. And you can do the internship for 1 year in Poland, and that's called staż. It's getting better. It used to have a bit of a bad rep, especially from pay, but I think the pay is actually not bad at all for starting off. So that's a quick intro. We're going to try and delve into the different topics regarding staż. So please allow me to give a warm welcome to Dr. Sebastian Bułynko. How are you doing?
I'm good. Thank you for inviting me to this podcast. I actually needed something like this, what we're doing now, where I could get to know more about the Polish staż a year back. Because before I applied for staż, I didn't know how to get in. I didn't know when to apply because we graduated May, June. And then obviously the Polish division, they graduate a few months later. So in your head, you're kind of thinking that, okay, staż starts a little bit later. You have a lot of time, but actually that's not the case because once you graduate, that is the best time to apply for staż. Basically, the first thing you can do after graduation is to get the zaświadczenie from the dean's office with your average grades.
You very quickly, just to make it like super clear, there are two versions of staż, right? Because there's staż in English and there's staż in Polish. And to give like a really quick theory, staż in English you have to pay for, and it costs probably from about 30,000 zloty and up, and it lasts 6 months, and it's in English.
Yeah.
But you can also do staż in Polish, where you are getting paid for the work you're doing, and that lasts 30 months. And that's what we're talking about today. We're talking about staż in Polish.
Yeah. So basically, the application process starts immediately, I guess, after graduation. And like Eddie said, there's two versions of it. For the English staż, you don't need much. You just graduate from Poms and you can get into the English staż, but you gotta pay. I think it's about 30k zloty. Whereas in the Polish program, you need to apply. You need the Polish language exam done, which you can only do it in Warsaw. Or if you're Polish citizenship, then you can do the Polish language, Polish LEK exam in Polish, and you just have to pass it, and that is enough to get into staż. But if you don't have Polish,
I believe that if you're an EU national or a Polish citizen, then you can do Polish LEK, and that's enough. But if you're not a EU citizen, for example, you're an Indian citizen, then even if you do Polish LEK, you still need to do that language exam.
Exactly. Yeah, you got to do both. You got to do the Polish LEK and the Polish language exam. Right. So that's the story, and how you apply. Because today I think we're going to talk mostly about the Polish staż, right?
Yeah, we only talk about Polish. Yeah.
Polish staż, because so how you apply for the Polish staż is through the Wielkopolska Izba Lekarska website. So
that's for Poznan, right? So every region's going to have a slightly different one.
Yeah.
Is the county which Poznan is in.
Right.
So you'll be applying to your county's Izba Lekarska, which is like the Ministry of Health.
Right. So so if you're from Wielkopolska, you would apply to Wielkopolska Izba Lekarska. If you would be from, for example, Małopolska, I think it's Małopolska Izba Lekarska. But so we're gonna stick to like Wielkopolska, Poznan, because that's where I applied through. And for example, should I give an example?
Yeah.
So once you log in onto the website, there is a tab called staż. You go on staż poddyplomowy, and then you have a few options. You have przed stażem, which is before staż, w trakcie stażu, po stażu. And you go on przed stażem, before staż, and there is a list of things you have to bring in to the Izba Lekarska. So a list of documents. There's a whole list of documents, and here it says there are 2 dates to apply for Polish staż, and for the październik and for marzec, right? For March. Okay, so with the LEC exam, there's also a problem, because once you pass the LEC exam, on the main website for the LEC exam, SMK, where you log in to see your result, you can print out a zaświadczenie of your exam that you completed an exam, but you can also send a certificate to Łódź, a request for a certificate to Łódź, and they send it back to you with an official stamp that you passed the exam. And this is very important for the Izba Lekarska when applying for a staż, because they do not accept the zaświadczenie, which you print out. They need a stamp that you passed the exam with the certificate. And it takes about 2 to 4 weeks for the certificate. So it's better to request for the certificate before the window period, the 2-week window period for the application of staż, because let's say you request on the first day of the application, and your certificate comes in 3 weeks after. So you miss the deadline, right, for applying for staż, which was actually my case. But they gave me an exception. I had all my documents prepared, except I told them I was waiting for my certificate. And once I got my certificate, I brought it to the Izba Lekarska, and and I was able to apply for a staż. But that was my moment where I was afraid that I might not make for October. Yeah.
So I have a question regarding timing then. If you take LEC and you pass it in September, because LEC happens twice a year, right? Once in September, once in, I believe, February.
Yeah.
So if I take it and I pass it in September, will that be enough time to start staż in October?
That is a very good question. To be honest, I don't know how to answer this question, because I know a few students were in this situation, and I don't know what is their case, if they got into staż or not, you know?
Okay. So we just have to, I guess, do your own research on that question.
Yeah.
Now, the next question actually I have is, what's the scenario regarding pay and salary?
Okay. So with the salary, I can give you guys an interesting fact. I have a few colleagues that did staż years ago, let's say 10 years ago, and the pay for staż was about 600 zloty per month, 600, 800 zloty per month. Whereas now, every year, they increase the salary by about 500, 600 zloty. And after tax, the pay right now at this moment is 6K, like a clean 6K with the jury, so with the shifts, and there are 4 shifts that you have to do per month.
So this is after tax, because
This
I
is
read somewhere.
this is after tax, after paying your ubezpieczenie, so your insurance. So yeah.
Because I read that the baseline pay is 7K. So I guess when you bring in tax,
they increased it.
That's about just under $2,000, right? Just for
yeah. Actually in Lipiec, every Lipiec, they increase the salary by 500, 600.
Okay.
So
And
before,
with that salary, because you mentioned that that's your pay with the 4 shifts. Now,
yes.
can you be doing overtime to be
Now
propping that up? Or
that is a question I guess every student, every statista wants to know. And unfortunately, there is no way of doing overpay because according to the law, you can't, as a stagista, you can't work as a doctor in any other place other than your work field, so as a stagista. And there is already a pile of money, I guess, that is already, how do I say it? There's already a pile of money prepared for you once you start stash, and you can't,
get more out of that pile.
yeah, you can't get more out of that pile. You can get less by not fulfilling the curriculums, like not finishing the jury, which are the shifts per month. So you can actually there's a chance of not maximizing that outcome. For example, let's say you are sick 3-4 days and you don't go to work, then you can take shifts because apparently it's a whole controversial thing. Nobody knows, but if you have more than 3 or 4 days off during a week, you are not allowed to take shifts. So if you are sick for 3-4 days, or if you take 3-4 days off, then you miss a week in a month, and you miss 1 shift in that month, right? So instead of getting 4 shifts, you get 3 shifts, and per shift you get about 350 zloty. So you are minus 350 zloty if you miss it.
Okay. So on that note, kind of like, what are the hours here? You mentioned like a shift. How long is a shift classically?
So
what are you
according to the contract, we have to work 7 hours and 35 minutes per day. And in a month, we have to do 40 hours and 20 minutes of shifts.
Okay.
Which comes about to 10 hours and 5 minutes per week of shifts. And you are allowed to split those shifts into 2 during the week. So let's say 2 shifts per 5 hours and 5 minutes, or 1 shift, for example, on a Friday, 10 hours and 5 minutes. So yeah, that's how it looks. So for example, you go into work at 7, you finish 2:35, and your shift starts at 3 p.m. Or let's say you continue it, so right after work 14:35, your shift ends at 12:45 at night.
Okay. So a classical day, which doesn't include a shift, you can expect it to be like from 7 till 2:30, something like that.
Yeah, in theory.
Okay, and practice differ. Are we doing longer or are we doing shorter, maybe?
Well, like, so
maybe not you specifically, but hypothetical person.
So like working 7 hours and 35 minutes plus the 40 hours of shifts per month is considered, if one does it according to the contract, it is considered a lot. I know hospitals or places where they do more, they do less, but usually that is, I guess, according to the hospital, right?
Okay. So actually, yeah, circling back a bit, because we kind of missed this. How do you choose where you're working? Do you choose? And, Are you also applying through a website, or how does that process look like when you're trying to decide where you want to work?
Yeah. So where you want to work is, I guess, from what I remember, one of the things you get to choose. You get to choose, but all the five hospitals have to be in one state, right?
Yeah.
So, for example, and it has to be a hospital on the list, which is most of the hospitals. I would say it's 90% of the hospitals. And for example, I'm from Poznan, right? So I could choose Szpital na Przybyszewskiego. I could choose Grunwaldzka. I could choose Długa. I could choose Lutycka. I could choose even outside of Poznan, for example, Puszczykowo. And how it looks is you get it according to your grades. So, for example,
Like grades or your school grades?
your school grades. You get it according to your school grades. They don't look at your exam grades, but they look at your school grades. And one of the top, I guess, hospitals are where they look at your grades is the Przybyszewskiego Hospital. This is the hospital that they choose the top students because most students live around that area and they want to be close to their workplace. And then from what I know, the other hospitals they let everybody who applies, but the hospital that is the hardest to get into, I heard it was Przybyszewskiego, that they choose the top scores.
Okay. And do you have any inkling of how you rank according to other people, or is it you don't really know, you just kind of know your own grades and based
Yeah,
off that?
that's the thing. Like you when you apply for staż, you have to go to the dean's office to get a zaświadczenie of your average grade. And the dean's office, they print out like a paper where he is a student or a postgraduate with this kind of average score. And they sum up all your scores. I think they just copy and paste the score that you get from the diploma. Um, and yeah, and according to that grade, there is no place to search for how many, what grade your friend got, or for example, you just have to ask them personally.
Yeah. Yeah. Okay. And when it comes to like the day-to-day work, what kind of jobs are you doing? What kind of things are you allowed to do? Are you, I would assume you're allowed to take bloods. Are you prescribing? What are the kind of day-to-day tasks that you can expect to be doing?
So everything depends on the ward and which specialty you're interested in. This is kind of a broad topic, so we're going to expand. Let's say you are interested in internal medicine. The doctors there will make sure you get the most out of internal medicine. Right? Let's say you don't want to go into internal medicine after staż, you want to do surgery. They're not gonna be using you as much, right? And you're gonna do the basics like blood pressures, documentation, przyjmowanie pacjentów, which is just doing basic interviews with the patients.
Yeah.
But if you're interested in internal medicine, then they will, I guess, push you to the limits. They will basically treat you like a resident, and there's no limit, I guess. There's no limit. However, when it comes to prescribing drugs, so it is a, I guess, controversial topic because you are allowed to prescribe drugs only under the supervision of your opiekun, which is the person that is taking care of you, the doctor that is taking care of you, and their stamp has to be on the prescription. So you can give your prescription, but
filling out the paperwork, but at the end of the day, it's actually that doctor who's doing
Yeah,
the.
yeah, you have to get their signature and their stamp. Yeah.
And what about like things like taking bloods? Is that part of it, or
So this, I guess, is more of a personal thing, because from what I see, I thought that that's the role as statista.
yeah?
But when I was at the internal medicine ward for 10 weeks, this is what the nurses were doing. And whenever we had a request from our residents or our specialists, and whenever they gave us a task, they always told us to tell the nurses to take the blood. They never told us take the blood. They were always like, tell the nurse to take the blood. So I guess it all depends on you whether you do it yourself or you tell the nurses to do it, because that is mainly the nurse's job at the ward to do it.
Okay. Yeah. How would you describe like a typical, let's say, normal day? I'm not talking about a shift, but like a normal kind of 7 till 2:30 day.
Okay. So my recent staff was in internal medicine, so I would come in around 7:15. Yeah. Sorry.
Yeah. No. That's good.
Yeah. So I would come in around 7:15. First thing I would do is change into my scrubs and go into the patients, check on the patients, how they're feeling, do the basics, blood pressure, check the pulse, check the oxygen levels, and report that to check on the patient, do some physical examination, for example, auscultate the lungs, if the patient has chronic obstructive pulmonary disease, or palpate the abdomen if the patient has some GI problems. And then this would usually take me about 20 minutes. Usually we have about 3 to 5 patients per doctor. So I would do this. I would spend about like 5 minutes per patient, and I would at 7:40 report back to my doctor with like all the vitals, with everything that I observed, and then she would either write that down into the system herself, or she would tell me to do it. This depends on the doctor, whether she trusts you or not, or whether she wants to do it herself. Because it's not much with the documentation. Sometimes we input the information to the computer, but it only takes 5 to 10 minutes, and usually the doctors that are taking care of us do it for us, so they can kind of get a summary of what they're doing. Because right after observing the patient that we do in the morning, we do rounds, and each doctor has to present their patient to the ordinator, which is the director of the board. So I feel like the residents, the specialists, they input the information to the computer themselves, mostly so they get prepared for the day themselves. So yeah.
Your ward rounds then?
Yeah. So and then we start the ward rounds at about 8:30. So we have, let's say, like between 7:40 and 8:30, we have time to sum up all the information gathered. Maybe go back to the patient if we missed something with our doctor. Maybe collect some blood results. Maybe get a request to the USG or gastroscopy or colonoscopy, and then just prepare all the documents, prepare everything, and by 8:30 we have the rounds. There's about 30 rooms. In each room, there's about 2-3 patients. So the rounds take a lot of time. We spend about 5 to 10 minutes on each patient. And the rounds usually take from 1 hour to 2 hours. And we go as a team, like all the stażiści, all the residents, and the director or the main doctor of the ward. Yeah. So and then after the rounds, we have a short break, or unless some of our patients are in critical condition, we get to work. We discuss with the doctor what to give, what drugs to change, whether the patient has to be moved from one room to another, because because our internal medicine ward divides into two, where you have less difficult cases and more difficult cases. In the more difficult cases, you have monitors. In the less difficult cases, we don't have monitors, just a bed, blood pressure, and that's it. And let's say that during the rounds, we figure out that one patient is in a critical condition. We transfer them into the ward with more serious cases, and then we monitor them. So we start rounds 8:30. We finish them about 10:30, and then we continue our job, or we have a break, 30-minute break, and about 11:30. We prepare the documents back into the computer, and then at about 12:30, we go back to the patients, and there's always just stuff to do. There's always drugs to change. There's always patients to monitor, and things take time in the hospital. Once we send blood work, for example, at 8 o'clock. Depends on the blood work. Sometimes we get them after an hour or two, but if we send for genetic testing, it might take longer. So sometimes there's some days where everything goes super fast, and then there's some days where we just have to wait and wait for the result, because we can't do anything without diagnosing the patient.
Okay. So that's let's say a typical day. Now, what do shifts look like? Are you looking after the whole ward, or how does a shift look?
So, luckily for a stażista, we are not alone on the shifts. We always have to be under supervision of a doctor above us, so a resident or a specialist. And we just assist them. We are basically like their assist. We don't do anything ourselves, because whatever we do wrong, they get in trouble. So we are mostly there for assisting, and usually the shifts are pretty calm. I guess most of the work gets done by 10 a.m. and from then it's just super quiet at the ward. I guess it just really depends on the seasons. During winter, there's more cases, more sicknesses, but now during summer, it's like I would say it's pretty chill during the shifts.
Okay, nice. With like you mentioned now that you had internal medicine, so how do rotations look like? How long do they last? Do you get to pick which specialties you're doing them in? And how many of them do you have?
Yeah, so when you start stash, you have a short. I mean, well, you start stash and you immediately have to plan out your stash. What week you're gonna do this, what week you're gonna do that. However, in some hospitals, they already make the plan for you. But in most hospitals, you have to prepare the plan yourself. You have to get the request from your coordinator. Once you get the request from your coordinator for the given, for example, ward, you have to go to that ward, they have to stamp that stamp your request that you want to start 2 weeks or 3 weeks, for example, in orthopedics. You go back to the coordinator, she accepts it, and then you start. You're allowed to start from there your course.
So is there like a minimum number of different specialties you have to do, or a maximum?
There is there's actually a list of specialties you have to do during stash, and they're all mandatory. Luckily, last year, or this year, they changed for our year. They changed. They added a new course or stash, if you can call it. That you can choose whatever, like an elective of 10 weeks. You can choose your given specialty. So, for example, I chose 10 weeks of orthopedics. They also, the difference between this year and last year, they canceled psychiatry and gynecology. So there is no more gynecology and psychiatry during the stash. However, these are the two that you can actually also do during the 10-week period. Also, another note, during the 10-week elective period, you can't choose the same stash that you did before. So let's say in your curriculum, you have to do 2 weeks of orthopedics. You're not allowed to repeat that. So you can, for example, do 2 weeks of orthopedics, and for your 10 weeks elective, you can do 10 weeks in trauma. It's technically not orthopedics, it's trauma. So yeah, so that's how it looks like.
Okay, I see. Now with this stage, it lasts 13 months, right?
Yeah.
Now, once that 13 months is over, once that stage is over, what happens next?
So I'm in the process because I started in October, so I still have 2 months left of stage to finish. But from what I see, once you finish all your courses, plus you have 22 days off, and you have 4 weeks of online courses that you do during stage. And this everything adds up to 13 months. And once you finish all that, you apply for residency. And I believe the application process for residency starts next month, on the 1st of September. And
So is that, when you say residency, is that applying to a specific specialty?
Yes, yeah. And this is yeah. So right after you finish stash, or like let's say on your last month of stash, you can apply for residency for your specialty that you would like to specialize in. And I think there's quite a bit of time. I think there's a 2-month window period for the application process. But again, that's another topic. I haven't reached that stage yet, so I don't know much about it yet.
So what about because which specialty you get will depend on your leg scores, things like that. What about if you don't do well enough and you don't get the specialty that you want?
Yeah.
Are you able to work as a doctor but not in residency?
Yeah. So there are a few options actually. The two options that you are kind of left with and available are you can either work in PLZ, so as like let's say family doctor, because right after you finish stash, you get your PLZ, which is like a document that confirms you are allowed to work as a doctor. And having that document, you're allowed to work in PLZ.
Family practice.
Yeah. What else? And then the second option, you can work in the emergency unit.
Okay.
There is always a need for doctors there. So once you get the documents after stage, you can immediately work in SOT, so emergency.
Yeah.
Also, there are a few specialties that you can get into with a low LEC score. I believe one of them is general surgery. I think you need about 62% for general surgery. And the passing score for LEC is 56. So a little bit above passing score. You can get into general surgery. I think emergency medicine too. And there's one more. Just forget. Maybe family medicine. I can't remember. Yeah.
Okay. Now, as we're bringing this to a kind of end, I wanted to ask you, do you have any kind of tips and tricks for someone going into stage, or any kind of things that you suggest someone prepare before stage, right? So like, what do you wish you kind of knew about stage, or which skills did you wish you kind of honed in on
Yeah,
before
that
you
is.
stage?
I guess that is a really good question. I think I would just practice my Polish a lot more because I think the most important about stage is just communication with the patient. Most of your tasks involve transferring patients from one unit to another, calling between departments, and just talking with patients. Just a lot of talking with patients and communicating with your staff workers, and just practicing Polish. I guess the medical terminology too, but just being very fluent in your Polish.
Okay. All right then. Thank you very much for this episode, Dr. Bułynko. Really appreciate it.
I tried my best. I really hope everybody got some information about staff, and yeah.
Okay. Cheers. Thank you very much then.